Hello, family and community. My name is Thelma Craig, and I am with the Colorado Black Health Collaborative. I'm so happy to present with an issue today that's really close to my heart. We have a project called Tackling Menthol in the Black Community, and we do this in collaboration with the Colorado Department of Public Health and Environment. And so this is Real Talk Moments with Thelma Craig, Real Talk Menthol Moments, because the subject is about menthol. It's about smoking. We really try to make sure we're educating the community, we're sure we're networking with the community and supporting the community because there are some real health issues when it comes to tobacco smoke. And so we want to really address this issue. And so we really appreciate you joining us today. We have some very special guests. We have Judith Tieku from the Colorado Department of Public Health and Environment. She is the tobacco specialist, cessation specialist at the health department, and she's going to be joining us also. Is Lisa Fenton, and she's a contractor with the Colorado Department of Public Health from Rocky Mountain Health Foundation. And so we're going to be talking about this special program that we are working with called My Baby and Me Tobacco Free Program. This is about pregnant women. This is about women, having challenges, stop smoking while during their pregnancy and after. And so we want to talk about this issue because it really is close to my heart, and I really think it's an important issue and hope that this is an informative session so that the community is aware that this is a problem and then how we can support our families and how we can support our community with this issue. So I'm going to let Judith Tieku, tell us just a little bit about herself. She's a really great supporter and collaborator here. So Judith, tell us about yourself, and then we will have Lisa.
Thank you so much, Thelma. I appreciate you inviting us to join your show today. It's a privilege for me to be here. My name is Judith Tieku. I am with the tobacco program over at the Colorado Department of Public Health and Environment. My expertise is in cessation among pregnant people, postpartum, and also youth. I'm really grateful to be here. Thank you.
Thank you, Judith. And we have Lisa Fenton. Lisa, tell us a little something about yourself. Judith, are you on mute?
No, can you hear me?
No. I think Lisa is on mute. Sorry.
Lisa is on mute.
That happens sometimes. I can't hear you.
Happening.
There we go.
There we go.
How
We
about
got it. And we have a great, thank you. We have a great communications team in the background, Paul and Tracy Grant from Ascender Communications.
oh,
So we're really happy to have them. Thank you, Paul and Tracy. But Judith, tell us something about yourself we didn't hear the first time.
well, I've been a registered nurse for more than 45 years. I was sitting in a nursing lounge getting my license in the early 70s, and we all sat around and smoked together. That was the world. I dream of a cigarette-free world, and my passion is helping pregnant women with their babies to have healthy babies here with tobacco-free lives.
Well, thank you, Judith, for really supporting the community in that area because we all want a tobacco-free. We want tobacco-free community so that we can address some of these health disparities. So, but first, let me start out, Judith and Lisa. But Judith, you can go first. Tell our listeners what is the My Baby and Me tobacco-free program? How is it designed, and who does it serve?
Thank you, Thelma. So the Baby and Me Tobacco Free program is a free, non-judgmental tobacco cessation program. It's evidence-based, and in fact, it's used by many other states across the U.S. This program is available to all Coloradans who are pregnant and want to quit smoking or vaping. The great thing about this program is that we offer free incentives for all enrollees, and partners or family members of pregnant people can also join the program. I will turn over to Lisa to tell us a little bit more about the design of the program.
Okay.
We started the program in 2008 with a private grant, and then in 2014, the state public health department has been supporting us, and we're tracking all the outcomes. Anybody can join by going, who's pregnant and a smoker, by going to babyandmetobacco.free.org. It's easy to get enrolled, and your physician or family friend can refer you, and you will receive individual attention for 4 prenatal sessions. And then once you deliver the baby, we have 6 additional sessions where you will receive 2 diaper vouchers. And that covers those diaper vouchers covers your choice at any Walmart center. You know, the biggest thrill for us, and Thelma has an epidemiology background, and so she knows what I mean when I say epidemiologically, they're really conservative when we give our success rate. But if we can get mothers through their 4 prenatal sessions, we have a 94% success rate. It's remarkable. No one
Great.
has that around the nation.
That's exciting. Great. That's wonderful. Wonderful. So Judith, some people may find it hard to believe that pregnant women would smoke. But it does happen, you know, and it's understandable. It's an addiction. Can you talk about the risk factors of smoking for pregnant women, and what is the goal we want to reach for those who want to quit?
Thank you, Thelma. So, as you all know, we've made great progress over the years with smoking prevalence. Unfortunately, smoking still remains high among pregnant people who are on Medicaid and among Black and African American adults. For Black and African pregnant people, smoking becomes a multiplying risk factor. Factors such as stress, other family members who smoke, structural factors such as how hard the tobacco industry targets our Black community, stigma, and sometimes the difficulty in accessing tobacco treatment care, makes it really difficult to quit. Most people want to quit tobacco, but
Mhm.
nicotine addiction is very powerful, and factors such as using menthol can make it really hard to quit. Our goal is to reach provide qualified support for all pregnant people who want to quit, and to improve birth outcomes of Black moms all across Colorado.
Yes, thank you. And menthol really is a challenge in the Black community. We have high rates of smokers using menthol, and so that's really important to mention. But Lisa, if someone has a severe smoking addiction and is concerned about having pregnancy complications, does your program recommend Medicaid over additional treatment sessions for participants who may need more support?
Sure. You know, every individual is responded and supported for what they need. And what happened during the pandemic, our mothers will go into one of our facilities to be tested. They breathe into a device to test their nicotine level. Well, when the pandemic happened, no one could go in. And so we went an inventive way and found a distributor who could provide us with portable smoking measuring devices. And a mom can blow into the device instead of once a month previously to COVID. She can blow into a device every single day if she wishes and receives feedback as to what her level of nicotine is. And then the facilitator receives that information and can call or text the mom or see what's going on if she needs any additional support.
Mhm.
We've been extremely concerned about uh, the mortality rate of Black pregnant women and the treatment they have received in our nation. And right now, 7% of our population is reaching Black moms, but we need to make that a higher rate because, as we all know, if a mom who is smoking has a premature baby or low birth weight baby, which often happens when you're smoking, that baby has lung issues, that baby can have immediate health issues, and even long-term uh, learning issues. And so the number one health initiative a mom can take when they're pregnant is to stop smoking. It will have the greatest influence on their health, but also very much so their child's health.
Well, thank you. That's very informative. Because we know that low birth rates and infant mortality rates and mortality rates of moms is really happening across the country. So, Lisa, no, Judith, either one, but I'm going to say Judith first. We know that pregnancy can be beautiful, yet stressful at times. And
Mhm.
a woman who wants to quit, especially for a woman who wants to quit smoking. Can you describe some of the most talked about smoking cessation related challenges and interventions for Black women, for Black pregnant women?
Lisa, do you want to share some of the
Sure.
challenges of enrollees? Yeah.
Right. There is so much concern by a mom that their baby is growing the right way and that they're going to be the best mom that they can be. And yet, so many of our moms are dealing with educational issues or poverty issues and so many other complications. It's that individual touch that facilitator, that other woman can help her deal with those individual issues. And here's a fascinating statistic, I think. Of all the moms who smoke in Colorado, 11% of them are having low birth weight babies.
Oh,
But if that mom gets through Our Baby and Me tobacco free, that drops. That will drop to 9.5%. Even any birth, whether a mom's smoker or non-smoker, is 9.3%. Our worry, of course, is in Colorado we have altitude issues too overall, but we drop that rate so significantly that it's remarkable and worthy of mentioning for any pregnant smoking mom.
well, thank you, Lisa. Um, this is really important because, according to CDC, Black women are dying of pregnancy-related causes
Yes.
more than any other racial and ethnic group. Has your program or Medicaid taken this disparity into consideration to expand the smoking cessation treatment plans for women of color?
Yeah.
Absolutely.
Mhm.
It is a horrific fact that that is occurring in this day and age and in our country. But here's one of the statistics. 66% of our mothers are living on an income less than $25,000. We're all experiencing what it's like to go to the grocery store, every single one of us right now. And then you look at an overall income of less than 25,000, that has huge issues. And of that 66%, 35% of them are living in $10,000 or less.
Wow.
And it's it's really critical for us to reach these moms and help them in any way that we possibly can. And cigarettes are costly too. So not only can we incentivize them and give them individual attention and walk with them as they're going through all of their stresses, but we can save them money and instantly reward them.
Mhm. And
And I'm
yeah.
Go ahead.
Thelma, over at the States, we are very concerned about disparities, in maternal mortality. We are working really hard and urgently to better understand these disparities. And we are hoping to expand Baby and Me to serve more Black and African American people, and pregnant people. We have a specific protocol in addition to the Baby and Me. We have one at the Quit line that solely serves pregnant people. And
Yeah.
so that's something that we're really working hard to expand. And we really applaud all your efforts that CBHC does to end the sales of menthol flavored cigarettes as well.
Well, thank you. Thank you for that. But I was thinking when we talked, I think we mentioned a little bit about the device, about the actual program. Can you say
Mhm.
a little bit about the device that women use in that process of
Mhm.
getting that?
Yeah, it's really quite fascinating. So the standard way where moms can still go into their local health department if they wish. If they wish to have face to face, they can. They could go into their health department and they test on a carbon monoxide device. But for those moms who struggle to get to that health department, who are those mamas who are carrying their other babies with them, trying to get on mass transportation or trying to get a ride from someone, we've eliminated that barrier. And we mail directly to them this little handheld device. And in it, they can blow into, just hold their breath and blow into it. We teach them how to do it. And they get feedback from smiley faces or half smiley faces. They can go on their Facebook and see their graph trend as to how they are doing.
Mhm.
And they get immediate feedback from the facilitator who is helping them. They stay with the same facilitator. They get to know her. Her name's Laura. She's a marvelous woman, and Laura gets to know their issues and sticks with them all the way through their delivery.
Well, that's good to know. And you talked about when they come in this program, there's incentive also to bring in their partners,
Mhm.
so that
Yeah,
everybody can be engaged in this
That's right.
process
Yeah.
and like that needed support. And so that's a wonderful piece of that project that you expanded, to include the partners and family members so that
yeah.
this can be effective for the pregnant woman.
Well, it can. Thank you for mentioning that, Thelma. So, if they are living with a family member or a non-family member in the same residence, we call that secondhand smoke that they're exposed to. And we also have third hand smoke, and that is the tobacco particles attached to our clothes. And after a mama has her baby and she's holding the baby, those particles can be inhaled from the baby. I never knew that years ago.
But that's another
I
topic. I think that might be another show, but go ahead.
Yeah, I think so too. And so we help the partner with them to quit smoking, and they get double the incentives then. Plus, it helps relieve the stress that they have if they're just alone in their family unit
Mhm.
trying to smoke, whereas everyone else is smoking. It brings up a partnership, and everyone's talking the same language and helping each other and doubly rewarded.
Yes.
And
Well, thank
Thelma, evidence has shown that when family members and partners embark on a quit journey together, they are more likely to stay quit
Yeah,
longer and even be successful in quitting. And so, there's always a proverb that if you want to go fast, you go alone, but if you want to go far, you go together. And so
yeah,
I like
that's why we found the need to add partner as part of this program.
I like that. I like that. If you want to go far, no, if you want to go fast, do it alone. But if you want to go far, do it
far.
together. So that's a
Yes,
great
Absolutely.
proverb. So I really appreciate that. We love our babies. We want our communities to thrive, and this is really an important issue. And I've even just from this conversation, I hear some other topics that we might address. The
oh,
secondhand
good.
and
Oh, good.
how it really affects the family in itself. I
Absolutely.
also like to say, okay, so these podcasts and these real talk moments, people have said that they need to be shorter because we don't all have a great attention span. So I want to wrap up. But we certainly appreciate you coming and talking about the name of the program, My Baby and Me, Tobacco Free Program. And I
Yes,
like the name because the name appeals to me. My baby, you want to like, what is this about? You want to
yes.
do more about that. Um, so to wrap up our interview this morning, what do you think is the call to action for the community? How can our listeners get in touch with the program and get a referral? And has there been any challenges experienced with getting into the program for pregnant women?
Well, it's easy. Just go to the website, babyandmetobacco-free.org. It's simple to enroll. There's a picture there on the screen. Put in your name, how long you have smoked. Now, if a mother quit smoking 3 months before she was pregnant, she's still eligible. And we did that because we know that when you're pregnant and you're dealing with so many stresses, there is a relapse that can happen. And we
Right.
want to support those who have already quit.
Mhm.
So they put their information in there and we get back with them within 1 to 2 business days.
That's great. That's great. Did you want to talk about a call to action, Judith?
Yes, absolutely. Thank you so much, Thelma. This is such a great platform for us to be able to
It
promote
is.
this program. The main reason why we're here is that, like I said, we have learned that the program is not adequately reaching Black and African American pregnant
Yeah.
people. And so that's why we're here to ask for your help in getting the word out and promoting the Baby and Me Tobacco Free program within your community. Not only providers can refer, anybody can refer a pregnant person, even a pregnant person themselves. We can refer ourselves to the program. And so I'm really thankful for this time. And I hope that we can work together to move the needle on pregnancy prevalence among
Oh,
pregnant
we
people.
it's an honor to work with you all on this project because our babies, our community, is really important to us. Smoking is an addiction.
It
Tobacco,
is.
it's an addiction. It is challenging, and there's no judgment. I think that because it also
Right.
has stigma behind it. I think people tend to judge people who smoke or who's trying to smoke, and where they need our compassion and our understanding and all the resources that we have to offer in the community. It's really important to be that support and advocate for the community. So I really appreciate you too, Judith and Lisa, coming on. But it's just, if you have just any other comments or information that you'd like to leave to our listeners about this program, and you can also call the Colorado Black Health Collaborative to get more information, and we will make the referral to the My Baby and Me program. But if you just have one more word to say, speak it up, Lisa.
I'm about to turn 70 years old, and I still am passionate about this program. I love holding these babies. I love kissing their cheeks. And when they are healthy, the world is their magic for all of us. They can do anything, but when they're born and they're struggling, it's hard from the beginning. So tell everybody about the program, and let's all be thrilled as we can hold these beautiful babies coming soon.
Well, thank you, Lisa. And Judith, one last word you want to say to our listeners and the community. I just really love the work that you all are doing. I really like meeting you. We met a few months ago, and I'm like, wow, we really need to get the word out about this program, My Baby and Me. And do you have a word you want to say to our listeners before we shut off?
Absolutely. I want to say the first of all, I want to say a big thank you to you, Thelma, and the whole
Yeah.
CBHC team for making this happen, giving us the opportunity to share about this program. Thank you so much, Lisa, for joining me on this Real Talk. I just, what I want to say is that the tobacco control program over at the Colorado Department of Public Health, we are very committed to reducing tobacco burden disparities, and we look forward to working together, to move the needle on smoking among
Mhm.
pregnant people. Thank you so much for your time.
Well, thank you. And really working together, collaboration, that's what it's all about. And I hope that we really send a message to at least one person today, to talk
Absolutely.
about this program, to refer this program, to talk about it with their families and their community, and so that's how we heal each other if we work together. So
We
thank you,
do.
Lisa, for
Oh,
coming, and
thank
thank
you
you,
so
Judith. It's
much.
been a pleasure talking to we did kind of stay under that 30 minutes because we're trying to make these shorter but more effective. So, and if people need other information, feel free to reach out to us, Colorado Black Health
Absolutely.
Collaborative, coloradoblackhealth.org,
Yes.
tobacco knockout page. So thank you
Yes.
very much, ladies.
God bless
Thank
you all.
you.
Thank you.